This short talk is about molecular therapeutics and its application in medical practice and more importantly molecular therapeutics. I am Dr. L. Prakash, an orthopedic surgeon. You can see here that there is an osteoporotic stress fracture of the tibia in a 56-year-old female. I would not have treated it the way the primary surgeon treated it. The index surgeon preferred to put dual EBOO plates with disastrous consequences in 3 weeks' time. You can see the exposed, nearly dead bone with the plate exposed. At this stage, the patient was advised amputation by 3 or more centers. Ozone came to our rescue. Ozone bagging has been done for 4 sessions. Once the wound was healthy and granulated, it was fit enough for the implant exchange and a full thickness vascularized graft, which was then done along with the fibular osteotomy. This is the fracture with compression and vascularized graft. There is the position after 4 months. The skin has healed and the bone has healed. The patient is happy and a limb has been saved. Another example sent by an orthopedic surgeon. His message clearly says, "This is my real sister, 40-year-old female suffering from chickenpox in 7 days." This is a very recent case, so more likely to be a monkeypox than chickenpox. Hydrogen infusion intrathecal given yesterday evening. See the effect overnight in 1 infusion only. And you can see that within 12 hours of a single hydrogen infusion, all the lesions are at the verge of disappearing, which is rather the miracle of molecular medicine. Now see this. This one was a young movie starlet who suffered from human papillomavirus. You can see the video on the left when the disease has just started and the video on the right with all the papillas clearly growing up. She had discussed with a venereologist in the United Kingdom and was quoted 25 lakhs for treatment, laser ablation and things like that. But she had a few sessions of vaginal ozone therapy, 1 session of EBOO and 1 session of MAHT, and you can see on the right side that the lesion is fully cured. Another case of buccal cancer with leukoplakia in a person who is a tobacco chewer. You can see the pre and post ozone therapy results. Here just a gauze or cotton soaked in ozone oil was packed and we could see the regression of cancer and regeneration of normal tissue. Now let us look at a few diabetic ulcers. This gentleman had already had an amputation of one ray and had a non-healing ulcer, metatarsal head visible, not willing to use a special footwear because he is a farmer and he has to walk in the fields. The only way was MAHT, ozone bagging, no skin graft, and there he is after the skin heals. Another patient, this is from the Dr. Deepak Sarotra's collection. At the ulcer, he only had one ray amputated. That is 3 months and that is 6 months. Back to the fields, barefooted and extremely happy. Of course, diabetes has to be controlled properly. And then here is a very rare case of IAOS who was roaming around for 23 years, even went to UK to try to get treatment, but they could not. The lesions were scraped, ozone bag, he was given an MAHT and ozonated oil application, and you can see that the wounds have all healed up. And then we come to the hot subject of today. What is the hot subject of today? Post-COVID or post-COVID vaccination avascular necrosis of femoral head. In my practice, I find an epidemic of avascular necrosis, a significant majority of them being post-COVID vaccination rather than post-COVID. In these patients, ozone MAHT or EBOO with Mukherjee regime has saved over 180 hips from THR in my own setup. You can see a Ficard grade 4 avascular necrosis with a sectoral AVN with more than 50% of the weight bearing dome avascular, and here you can see the same patient exactly after 2 years, no collapse, head revascularized, joint maintained, and the shape is identical. This is another one, bilateral Ficard stage 4 with impending collapse. You can see the X-ray on the left with near impending collapse and start of reduction of joint space. The X-ray in the middle showing the effect of ozone and Mukherjee regime, and the X-ray on the right showing complete recovery, normal sphericity and normal bone health. This patient underwent 2 major autohemotherapy, 1 EBOO and 1 Mukherjee regime. Duration, the treatment of Mukherjee regime was for 12 months. And these are the expanded images of the X-ray where you can see very bad hips getting revascularized, practically back to normal. Majority of the audience and viewers here are not aware of how these crazy results are produced. What is strange and crazy orthopedics? This is the magic of molecular medicine. What is molecular medicine? Use of natural molecules which are either available on earth or alien to the earth. The 2 common molecules used in medicine are ozone O3, hydrogen H2. What are these molecules that produce such seeming miracles? What is EBOO? What is MAHT? Or what is hydrogen infusion? I am showing an example of a major autohemotherapy on myself. Heparin is now introduced into a lactutinol bottle. Heparin is primed into a drip set. A butterfly is attached to that. The drip set goes into a UV irradiation chamber, and then once the flow set is opened, blood automatically flows into the bottle. A needle is bent at right angles and ozone flows into the blood, making it cherry red, and then with UV irradiation the blood is retransfused into the body. I take regular MAHT usually before travels, and this has cured my allergy and post-travel viral infections. What are these molecules and how are they produced? How do we get them for our patients? Ozone is a naturally occurring molecule. Ozone is produced in nature by whenever we have fresh rains and lightning, or all these conditions produce a very fresh smell, and that is a natural ozone. We live on a polluted earth today with lot of toxins surrounding us. The ozone layer in the stratosphere detoxifies and keeps us safe. About 20 kilometers above the earth, there is a layer of ozone, and that helps the earth to be alive and pure by protecting our mother earth from harmful radiations from the outer space. How do we produce ozone in our clinic? We produce ozone in our clinic with an ozone generator. These are examples of IAOS medical ozone generators. We need a B-type oxygen cylinder. We need a dry oxygen regulator. This shows the demonstration of a Mark V IAOS machine with various functions. We are just opening the machine, connecting the oxygen, putting the output at 1/8, allowing the ozone to come out, which is tearing the glove. The ozone fills up into the syringe. Ozone is very active against natural latex, and we can see how it tears natural latex. This is the vacuum producer, which is very useful for multiple pass ozone therapy, where we are going to pass the ozone into the bottle. Ozone can be administered by many routes and causes many beneficial effects. Given intra-articular, it causes gaseous arthrodiastasis in stiff joints. You can see an elbow, you can see a wrist which is very, very tight, arthritic, rheumatoid, and immediately after ozone infiltration, the joint opens up dramatically, giving a very good space. So we can have a pre-operative pre-procedure and post-procedure joint space in this. Similarly, we can see an elbow joint pre and post procedure. Despite significant damage to the joint, the space is well maintained. Immediately after the procedure, the movements will increase, and whether it is for an elbow or a wrist, the patient will have significant improvement of movements. Hydrogen is a wonder molecule which can be combined with ozone to produce hydrozone. Though hydrogen is the most abundant molecule in the universe, it is not found in its native form on this earth. Hydrogen is a diatomic molecule which is the lightest element and the lightest molecule in the universe. Molecular hydrogen is a new miracle molecule in modern medicine. This is the strongest antioxidant known to humans so far. Though 67% of the earth is formed by H2O, water, H2 in its molecular form is not available on our earth. Numerous clinical studies world over have found molecular oxygen, molecular hydrogen to be very, very beneficial in a wide range of conditions, from severe hypertension to post-malignancies and chemotherapy toxicity. This is a message from one of our friends and colleagues who has clearly written that my BP on monitor was 141/92 before hydrogen infusion and nutraceuticals yesterday night. In the morning I played cricket for 1 hour. Thereafter, when I tested my BP, it was 117/75. It is the first hydrogen infusion and nutraceuticals on myself. And he sent a screenshot of his blood pressure also. This video shows his infusion. We can see he is having a hydrogen infusion, and we can see his BP 146/97. The next morning, his blood pressure is 115/75. To produce a 99.99% pure hydrogen, a hydrogen generator is needed. This is IAOS hydrogen generator, which is CE certified for medical applications including intravenous use. In England and Europe, IV drips are a great fashion, and hydration, multivitamin drips and similar drips are given to patients at a very, very high cost. A limitless drip of hydration, B complex amino acid and the lots cost phenomenally high. However, in India, the drip system has not become very popular. The question that came to our mind was it safe to bubble hydrogen in normal saline with or without antioxidation and infuse it into the human body? Does bubble hydrogen dissolve in water or saline? Scientific studies calculated the solubility at 25 degrees to be 7.8 in 10 to minus 4 milliosmol per liter. We have all seen sports persons drink foamy water for sports performance. Inhalation and drinking of hydrogenated water have proven health benefits. So, why not IV bubbled hydrogen infusion? Does this procedure cause any harmful effects like embolus, etc.? Can we combine antioxidants with hydrogen bubbling in saline? The only way to know whether this will work was to try on myself. And that I did. You can see I mixed 500 ml of saline with nutraceuticals, vitamins, and then bubbled 600 ml of hydrogen through the set and got myself infused. You can see the micro bubbles of hydrogen in the bulb which are going into the body. Immediately after my infusion, I could find dramatic increase in my energy levels for the next 15 days. My average caloric burning out was 450 calories before my infusion. But immediately after the infusion, my Apple Watch showed me that I have started burning 708 calories. My walking distance increased from 8 kilometers to 12 kilometers, and this effect lasted for more than 14 days. Acting at mitochondrial level, the antioxidant effect of hydrogen has been found to be age regressive, performance enhancer, and useful in COPD, cancers, allergies, and numerous other conditions. This is my own story about altitude-induced hypertension. Last IAOS conference in Pokhara was held at high altitude in Nepal, and the moment I came back from conference, my morning blood pressure recording was 163/98. Instead of going to walk, I went to the hospital and had my hydrogen nutraceutical drips, and instantly, within 4 hours, my blood pressure came down to 144/90. So, just one infusion, we have reduced 8 mm of diastolic and 20 mm of systolic pressure. And subsequent pictures will show my daily BP recordings. No medications were taken. Besides the BP recording is a machine which shows the dates and times. You can see from 149/89 to 125/85 to 103/69, 68 is the pulse. So from 163 to 103, that is 60 mm systolic, 98 to 69, that's 32 mm diastolic, 77 to 68, 12 mm pulse rate reduction in 4 days after one hydrogen infusion is what I could experience. So 60 mm systolic and 30 mm diastolic pressure reduction in 48 hours with no further medication was really miraculous for me. And what was the cocktail I used? 2 grams vitamin C, 1.2 gram glutathione. Now I use 2 gram glutathione, 1 ampule vitamin B12, 1 ampule polybion B1, B6, B12, 600 ml per minute of 99.99% pure hydrogen bubbled infusion. So this is my blood pressure now when I am preparing my talk. My reading as this talk is being made. I am trying weekly hydrogen infusions in about 26 patients, and the drugs are being reduced drastically, antihypertensive drugs. Later I experimented on intra-articular injections in osteoarthritis by combining ozone and hydrogen with excellent results. This is called a hydrozone arthrodiastasis, a case by Dr. Jignesh Patel. We can see how the injection of ozone and hydrogen is increasing joint space and causing arthrodiastasis, which is subsequently followed with Mukherjee regime. The next video is about a hydrozone hip. So the above video showed the effects of hydrozone in hip and the procedure. Now this is EBOO. What is EBOO? Extracorporeal blood oxygen ozonization. In this, what happens? Blood is taken from one vein.
Good morning, friends. This video will be demonstrating hydrozone arthrodiastasis of the hip with UVBI-MAHT for avascular necrosis of femoral head with early arthritis. The IAOS methodology consists of hydrozone arthrodiastasis, UVBI-MAHT followed by Mukherjee regime for 18 months. The procedures are repeated every 2 months. Video shows the complete procedure and the immediate post-injection results of the patient. Here is a 24-year-old patient with an avian, reduced joint space and almost stiff hip who had less than 50 degrees of flexion. You can see the extent of the arthritis and the fixity of the hip by the X-ray position itself. First of all, gloves are on. The inguinal area from where we will be approaching into the hip joint is cleaned. The procedure can be done inside an operation theatre under C-arm or in the theatre premises without a C-arm if the surgeon is experienced enough. We are going from anterior. The patient has got a lot of pain and you can see the slight flexion deformity of the hip. First of all, we take 1 to 1.5 ml of 2% xylocaine or lignocaine, to which we add 10 milligram of Kinacot. Steroid in low doses is chondroprotective, especially intra-articular long-acting steroid. This is then diluted with 6 to 7 ml of water to make it close to 8 ml. We must remember that this cocktail plus gaseous molecular hydrogen plus gaseous molecular ozone should all be administered through a single prick using the same needle while the syringes are changed. We now take a bivalve or a 3-way. First, a 10 cc hydrogen compatible syringe is used, which is attached to one end of the 3-way, and the 3-way is kept closed because we do not want the hydrogen to escape. Now we extract hydrogen from the hydrogen generator and immediately lock it in a 3-way and check the pressure to see that hydrogen is trapped inside the syringe. Now we take ozone in another syringe and that is put on the other side. For ozone we use a latex free syringe. Here we are collecting about 20 milliliters or 25 milliliters of 70 microgram percent of ozone. So we have taken 20 ml of 70 microgram ozone concentration, 10 ml of 99.99% purity hydrogen. These two syringes are locked and kept aside. The gases are retained in them till injection. We now enter the hip joint and inject the cocktail straight through, you may have to put a little pressure as it's a tight space, and after injection only the syringe must be removed. We must not remove the needle. We now attach the hydrozone combination. First of all, ozone is injected, and once ozone is injected, the bivalve is turned the other way to allow hydrogen to be pushed in, and this causes an arthrodiastasis or opening up of the tight joint space. For ultraviolet blood irradiation, it is better to wear UV protective glasses so that staring at the ultraviolet radiation does not cause any damage to the eye. 1 ml of heparin is taken, and this goes into the IAOS MAHT bottle. IAOS MAHT bottles are pre-vacuumed and have 3 spots: a small round spot for the heparin, a big round spot for the blood, and a plus spot for the ozone. The transfusion set is now primed with 0.5 ml of heparin. This is a real-time video where it has not been speeded up so that you can watch the procedure as it happens step by step. Half cc of heparin is now put, and the drip set is shaken to ensure that this heparin travels up to the bulb, coating or priming the interior of the drip set. The drip set bulb is capped, and the opposite end is attached to a butterfly 18 gauge, and this system becomes sealed. The bulb is passed through the UVBI illumination system, and the set is closed before the butterfly is inserted into the vein. Using a tourniquet, the vein is identified and the butterfly is inserted into the vein. Once the blood starts coming into the butterfly cannula tube, we open the transfusion set and we push the bulb into the vacutainer bottle before opening the transfusion set, and once it has been pushed in thoroughly, the transfusion set is opened. Once it is opened, blood starts flowing into the tube due to gravity, against the gravity due to the vacuum of the bottle. In less than a minute, 50 to 60 ml of blood are collected in the bottle. At this stage, we need to draw 50 to 60 ml of 70 microgram percent or 70 gamma of ozone. The bottle has markings, and when the blood crosses 60 ml, we close the drip set and stop collecting the blood. The drip set is closed. The ozone is drawn from a machine. Here we have used 1/8 of a liter per minute on the regulator, along with switch 2 of IAOS Mark 5 ozone generating machine. Once the ozone is collected in the syringe is removed, a needle is attached to the tape, and the needle is bent to 90 degrees. This needle goes to the plus into the bottle and the ozone is sucked in automatically. The bottle is inverted. The syringe alone is removed and that needle is retained as an air vent. The bottle goes into the ultraviolet radiation chamber where the UV lights are switched on. Now the patient has already started flexing the hip beyond 90 degrees because the arthrodiastasis has become effective and the pain in his hip is reducing considerably. It takes less than 5 to 7 minutes for the blood, ozonized blood, to return into the patient's body. We wait till the blood is completely gone from the set, after which we need to remove the transfusion set and then pad and paste tightly to ensure that the blood does not leak. The subsequent videos show the immediate post-operative movements of the patient. We had actually shown you the demonstration of hydrozone arthrodiastasis with ultraviolet blood irradiation and ozone major autohemotherapy for avascular necrosis of the hip joint, and this is the immediate post-procedure video where the patient is squatting. This patient had a fixed flexion deformity and could not flex beyond 50 degrees prior to the procedure. Immediately after the procedure, he is sitting squat-legged and he is smiling. He is getting up unassisted. For further details about equipment, technology or ozone courses, please contact the above number in WhatsApp. Thank you very much. Thank you.
Goes into the EBOO machine, gets ozonized, the purple blood becomes cherry red and then is injected into the opposite vein, which is the recipient vein. So from donor vein, blood is taken and it goes back into the recipient vein. The whole procedure takes about 20 minutes and will cause dramatic improvement in pneumatoids.
Good morning, friends. This is a talk about EBOO 5, the 5th generation extracorporeal ozonization. This is the world's first non-dialysis filter system. The full form of EBOO is extracorporeal blood oxygen ozonization, and Indian Academy of Orthopedic Surgeons is proud to introduce world's first filter-free EBOO system. This is the world's first system, patent pending, which uses borosilicate flint-free special sterile flasks. Though MAHT or major autohemotherapy is a common and routine procedure, EBOO remains a very less performed one. These flasks are autoclavable and reusable, however, are supplied sterile, and should the practitioner elect to dispose them after every case, he is welcome to do the same. For those who are not keen to use re-sterilization, pre-sterile IAOS bottles are also available. This has been christened or named as the Prakash Prasham Arul system. In MAHT, 50 milliliters of 70 microgram ozone is diffused into 50 ml of heparinized blood. In EBOO, the principle is to continuously withdraw 1 to 2 liters of the patient's blood, ozonize it and retransfuse it back into the patient. The indications are the same as MAHT, but it is 20 times more effective than MAHT, and the total duration of treatment is reduced from 10 MAHT sessions to a single MAHT session. Please remember that EBOO can be only done in subjects with good large veins, where a 16 gauge Venflon can be introduced into both elbows. Cheap, uncalibrated machines like the one shown here are contraindicated for EBOO. To avoid blood frothing and foaming, ozone flow should be low. The ozone flow should be low in volume, high in concentration, and be constantly monitored. Laboratory ozone machines like the one shown here and plethora of tin boxes that are available across the world are not suitable for EBOO. IAOS Mark 5 and Mark 6 machines are recommended, but any machine that produces 70 to 80 micrograms per ml is acceptable. The ozone therapist constantly monitors the blood inflow, the blood outflow, heparin mix ratio, and the ozone inflow to ensure that the blood is properly ozonized. Unlike renal filter based EBOO systems, where very low ozone concentration is used, in this system 70 micrograms per ml of ozone is used. Sometimes we go up to 80 micrograms also. If blood froths and the bottle gets full of bubbles, ozone inflow is stopped till the level comes down. The EBOO flask level is always maintained at 60 to 70%, and the oxygen inflow from the regulator is between 1/16th and 1/32nd of liter, 1/32nd liter per minute. If the flask level gets lower, we reduce the blood inflow and increase the perfusion pump speed. If the EBOO flask level becomes below 40%, we slow down the transfusion rate and speed up the perfusion pump to get the appropriate level back again. Prakash Prasham Arul EBOO system does not use renal filter and has nothing to do with dialysis. The color change of blood is due to actual ozonization and not due to renal filters. Please note this number. If you are interested in the system, purchasing it or trying it, you can message me personally. Velicio Bocci was the first to make a crude EBOO machine, but it was abandoned due to numerous problems. Subsequently, ozone therapies in many countries like Cuba, Russia, Philippines and Malaysia has now it has become curtailed, Germany, etc. developed their own EBOO systems. However, all these systems were and are flawed and defective. The systems depended on renal dialysis machine and renal filters for operation. This is a wrong system, totally unsuitable for EBOO. But this is the world's most popular system. In these systems, blood is filtered through a cellulose triacetate filter and ozone is adsorbed ADSORBED while filtration is happening. You can see they are CTA by a Renac company of Japan, which stopped manufacturing it and now it is being manufactured in Thailand and supplied across the world. This is unsuitable and incorrect method of using an EBOO. So these complicated pipings, tubings and plastic filters are not recommended. Crude and unscientific renal CTA based filter ozone adsorption EBOO systems are currently used widely world over. So the world is full of complicated and wrong EBOO systems like this. None of these systems are correct and follow logic, reasoning or science. The ideal system would be one in which ozone is diffused in the blood and not adsorbed, adsorbed. The ideal system would be made in borosilicate, flint-free glass with silicone stoppers without filters. This is the Indian Academy of Orthopedic Surgeons borosilicate flint-free flask with a stainless steel diffuser without a filter. The ideal system would not use nephrology dialysis filters because EBOO has nothing to do with hemodialysis. The system must use simple, easy to fit tubings which are 100% ozone compatible. Ozone must be diffused and bubbled through the blood and not ADSORBED. A stainless steel diffuser is preferable. This is the compact and very handy sterile IAOS EBOO system. The procedure must not take too long at time, and as the patient is stuck with two tubes, must conclude within 20 to 40 minutes. If 70 micrograms per ml ozone is extracorporeally mixed with 100 ml of blood, the blood will be perfused with 0.07 ml of ozone per milliliter. 1 liter of blood will thus be ozonized by just 7 mg of ozone and 2 liters with 14 mg of ozone, which is very safe dose and very low dose. Unlike conventional systems where 5, 10 or 20 microgram per ml is used in EBOO, in this IAOS system we use 70 to 80 micrograms of ozone per ml and thus for a 5 to 6 liters of blood in the body, 7 to 10, average of 10 ml of ozone is introduced. This makes the system deliver as much ozone as 26 sessions of 70 microgram per ml of MAST procedures in a single 20 to 40 minute slot. This is the IAOS EBOO system. The bottles are flint-free borosilicate with stainless steel diffusers. The transfusion system comes in set 1 and set 2. Set 1 is for inflow and set 2 is for outflow. As mentioned before, plain venflons and the above set is used for EBOO, and the following are the detailed steps of the procedure. First, 0.5 ml of 0.5 ml or 2500 interaction units of heparin is mixed in 5 ml of distilled water, and the syringe is kept handy. So this 25,000 heparin is 25,000 in 5 ml. It comes in two versions, 10,000 in 5 ml and 25,000 in 5 ml. We do not want to open the transfusion sets or mix heparin in the saline or open EBOO flask unless we get a proper vein which will allow the procedure. If we are not able to get a 16 gauge venflon in the donor site, I usually abandon EBOO. Thus 0.5 ml, 25,000 IU heparin is mixed in 5 ml of distilled water and syringe is kept ready as a first step. You can see from a 5 ml 25,000 unit heparin bottle, just 0.5 or half ml of heparin is withdrawn. The same is mixed with 4.5 ml of water for injection, and then the syringe will be capped and kept aside for later flushing the venflon. Depending on the patient's vein, 2 16 to 18 gauge venflons are used. 1/16 is essential for withdrawing the blood. 18 can be used for retransfusion, though I prefer 16 for both the veins. A tourniquet is tied to the donor site and the veins are identified. You can see that a velcro tourniquet is tied. This patient is suffering from polyarticular rheumatoid with multiple deformities in all joints. 16 G venflon is now inserted and the heparin syringe is attached to the end of the venflon. You can see the procedure now. The vein is visualized and a 16 G venflon is inserted. Needless to say that all the performing staff must wear gloves. So we have identified the vein, located it, and I am now fixing the syringe with heparin to the venflon, flush it a little and keep it open. The venflon is now pasted. The glove has to be removed because we cannot put a sticking plaster with a gloved hand, and the operator will wear her gloves once more once she finishes the procedure. So now we go to the opposite arm to get the patency in the other side also. The important thing is it is better to have 16 on both sides, because if the donor site does not get adequate inflow, we can always change from one side to the other. Now the remaining 4.5 ml of heparin is withdrawn and injected into a 500 ml saline bottle. You can see that 4.5 ml of heparin is being withdrawn and mixed in a 500 ml bottle of saline. We will also withdraw 5 ml of this heparinized saline, cap the syringe and keep it separately for the opposite side. We can see that is being injected into the saline bottle. The bottle is now well shaken to mix the heparin properly, and now we withdraw 5 cc of this heparinized saline and cap the syringe and keep it separately for flushing the opposite side. So this is what I have just done. The opposite side vein is identified and another 16 gauge venflon is now inserted. You can see the venflon is being inserted and the syringe is attached and pushed or flushed to check the patency of the vein. The tubings are now opened and fixed appropriately. This drawing shows the inflow tubing. The end with the filter goes from the top into the EBOO bottle. The bulb without the filter goes into the bottom of the heparinized saline. The silicone tube goes into the perfusion pump and the lower lock goes into the patient's venflon to draw the blood. We can see the opening of the system. The sterile packages double wrapped are opened. In this we will find 2 bulbs, one bulb with a filter and one bulb without filter, and the lower end with a lower lock to go into the patient. The entire system is latex free, 100% certified, ozone compatible. The bulb without the filter goes into the heparinized saline, which is now open, and the entire system will be flushed, including both the tubes. Once the system is flushed, we can lock or close the heparinized saline. Our set now contains heparinized saline so that the whole tubing system is primed. The same thing is shown again. Once the EBOO flask is hung in the stand, appropriate connections are first inserted to the top. The filter equipped bulb goes into the EBOO flask from the top through the bigger circle. The silicone part of the tubing is introduced into the IAOS perfusion pump for extracting the blood from the donor site. Ozone out from the machine is connected to the ozone in plus symbol top side in the EBOO flask to prime it. The lower plastic end is attached to the blood out venflon in one of the cubital foci. the pump can be started and the blood mixed with low dose of saline anticoagulant mixture flows into the EBOO bottle. We can see that an EBOO bottle is taken. In the top larger round hole, the filter part of the bulb is fixed. This is a special IAOS perfusion pump. The silicone part of the perfusion system is now, a silicone part of the perfusion tube is now put into the pump and locked in place. The machine is very small and handy. This can give a speed between 1 ml per minute to 100 ml per minute. Will suck the blood from the patient and push it into the bottle. We now take a silicone tube, take a 16 gauge needle. The needle is bent at right angles by using the needle tip, and this is now inserted into the top of the bottle, into the plus mark which goes straight into the stainless steel ozone diffuser. The other end is attached to the ozone machine. The ozone out, oxygen in is already attached there. The regulator is turned to 1/16 or 1/8 of liter per minute, and the ozone started to prime the bottle to prepare for filling the bottle. An ozone out needle is attached. This will be later connected to a silicone tube and a glass bottle to catch the froth. The heparin syringe is removed. The tube is connected, opened, and the perfusion pump is started as the blood begins to flow into the machine. Here, because of the patient's movements, there is a mild kinking of the donor site, and so we have decided to change the donor site to the opposite side. This will now be the inflow or recipient site. As the donor vein was not extracting the correct flow of blood, the same was changed to the opposite side. That is why one must have two 16 gauge venflons well anchored and well placed into two veins and well pasted with dynaplast to make sure that we are able to extract the blood. The silicone part is adjusted a little more, and once again the pump is started and the blood will start flowing comfortably. You can see the blood coming in. We have not yet started mixing heparin because already these tubings have been primed with heparin and the blood gets anticoagulated. You can see the incoming venous blood is little dark. Once it is ozonized, it will become tomato red. So you can see the blood rising up and slowly going into the bottle. The ozone tube is bubbling ozone into the bottle, and slowly we can see the color of the blood change from purple or violetish to red or tomato red. Tubes are positioned in such a way that we ensure that the blood inflow is proper and the EBOO bottle is filling up. The regulator is set in appropriate concentration to produce 70 micrograms % of ozone and is connected to a 16 gauge needle. The blood in the flask begins to get ozonized as seen in the video. You can see the gentle bubbling of ozone and the upper part of the blood becoming red. The lower part is not as red because the stainless steel tube only extends to a particular level. So this inflow is now at 25 drops a minute. Blood is coming in. Heparin has been opened at a very low level and that should be about 10 drops, 15 drops a minute, and the bottle is slowly filling up as it is being ozonized. This part is the inflow. The flow of ozone, heparin and blood is constantly monitored to ensure a constant ozonization at about 70 micrograms per milliliter. So you can see here it is coming up and the ozone is going out. The blood is being bubbled. We must ensure that the blood level in the bottle remains between 50 to 60%. Ozone is diffused at 70 microgram % and in 1 minute we can see the blood turning cherry red. Once the bottle is more than half full, we insert the part 2 of the IAOS EBOO set from the bottom of the EBOO flask. A bivalve is attached to the lower connector at the end of this set. The set is now connected to the opposite venflon for blood in, and the flow is matched with inflow to ensure that the bottle remains between 50 to 60% full at that time. The heparin saline stopper is again adjusted and a very slow speed of 5 to 7 drops is taken. Now this is the outflow. So a bivalve is taken. The bivalve is connected to the lower lock. Here the blood is going to go through the recipient vein and this is now inserted to the bottom of the bottle through the large hole, large circle. The set is primed and once it has reached the opposite end, we can connect the bivalve to the patient's venflon. This was the same venflon which was initially used for donor, but now it is used for putting back the blood. It is connected and blood flow is adjusted to match the inflow. as the filter tip does not reach the bottom of the bottle. The blood was initially a little dark, but now bright cherry red blood is coming back, and we can see the difference in color between the inflow blood and the outflow blood. You can see that the blood that is coming in is purplish, the blood that is going back is tomato red or cherry red. We have reduced the inflow rate to 10 drops, 10 ml per minute. That will be only 600 ml per hour, whereas the inflow is now going at the rate of 40 to 50 drops a minute to ensure that the bottle remains at a 50 to 60% level. A silicone tube attached to a 16 gauge needle is attached to the outflow so that the waste material or byproduct of ozonization or bubbles are coming out. Occasionally, when the ozone froths the blood, the flow is stopped for a few minutes. We always keep the inflow between 1/16th to 1/32nd of a minute to ensure that the blood remains tomato red. You can see the complete procedure. The ozone out is connected to a tube. That tube comes down, goes into a glass bottle. The blood flow is adjusted. The ozone flow is adjusted. Ozone flow is reduced if the blood froths. So by constant monitoring and ensuring that the blood levels are retained at half to 60% of the bottle, we can increase the flow up to 40 ml per minute. The main idea is up to ozonize about 1 to 1.5 liters of blood in as short period as possible. Perfusion pump speed can be controlled, increased or decreased to make sure that the EBOO flask always remains more than 50% full. In a similar manner, ozonized inflow into the patient is also controlled using the stopper. The theory part, very important. Our aim is to ozonize 1 to 1.5 liters of blood with 70 micrograms of ozone within 20 to 40 minutes, depending on the patient's veins. In patients with good veins and a good 6 kg Venflon, clear flow, the same goal can be achieved in 25 minutes or less, even 20 minutes. Normal people who come for this procedure get the procedure completed in 18 to 20 minutes. So this is what I have already mentioned earlier. Ozone regulation and froth generation have to be controlled by keeping the oxygen inflow between 1/16 to 1/32 of a liter. So you can see that till now less than 50 ml of heparinized saline has been injected. The patient's comfort is being monitored. Her general condition is also being asked repeatedly whether she is feeling good or not. We keep comparing the colors of the in and out of the blood, and we can clearly see that her face is getting flushed. We can easily differentiate in color between the venous blood and the well ozonized oxygenated or hyperoxygenated blood. We can also easily appreciate that much lesser than 100-150 ml heparinized saline has been mixed in about 1.5 to 2 liters of blood. So this will show you almost near the end point of the treatment, the excess frothy ozone is coming into a bottle. It has not yet collected. Much less quantity is coming, unlike the renal diuresis. we can see the quantity of saline infused. The color difference is not due to dialysis filters, as absolutely no filters are used. This is real oxygen-rich blood, unlike the renal filter EBOO systems. You can see in this video and you can appreciate the color difference between the donor and recipient side. On my glove, one side is the blood that is coming in, which is purple. The other side is the blood that is going back, which is almost bright and tomato red. So this is the Prakash Prasham Arul EBOO system. Once the desired time period is over, the donor pipe lower from the inflon is removed and the inflon is closed. So we can stop the pump, close the knob, remove the connection from the lure and lock the inflon. Now we start the pump again, and this remaining blood from the tube is sucked by the machine. We are allowing the perfusion pump to pump in continuously till all the blood in the pipe is pumped into the EBOO flask. So here you can see the remaining blood is pumped into the EBOO flask. Not one drop of blood is allowed to remain in the set. The entire blood will be transfused to the patient. You can see that at 20-minute time, how much of froth collection is there. The perfusion pump continues to run until the blood in the pipe is pumped into the flask. And once the blood in the flask once all the blood goes in the flask, the pump is switched off and the transfusion set is removed from it. The connections from the top are removed and only the blood flowing into the patient remains. So all the excess tubing, that is, first we are waiting for the blood to go into the bottle fully till the last drop, and there it is going into the EBOO flask. Now has come the time to switch off the pump. The top portion inflow is removed. The silicone section from the perfusion pump is removed. The top part is removed. And along with the heparin pipe, the inflow part is disconnected and discarded. All the while, at a very slow rate, the blood is being transfused back into the patient. This procedure does not entail wastage of a single drop of blood. The ozone outflow is now removed. You can see the patient is wearing an ozone mask to protect her. Needles are discarded. The ozone in is taken away. The ozone out is taken away. Now all that remains is the bottle with the blood which is being perfused, and you can see the color of the blood is cherry red or tomato red due to ozonization. By now, about 1.5 liters of blood have been perfused. This patient had a low oxygen saturation of around 94, 95 pre, and even while transfusing it became 98. The blood flow, when it slows down, we can add an air vent because the pressure is low, or the bottle can be raised high. Once the last drop of blood enters the patient and the EBOO bottle is emptied, the procedure is over. So you can see the bottle is raised, blood is trickling and dripping out and reducing. You can see the ozone bubbles inside the bottle and the blood flowing out. Once the EBOO bottle is removed, bottle is empty, the transfusion set is removed and is raised to a higher level than the bottle to allow all the blood to drain into the recipient venflon. Once this is concluded, lower connection is removed and the venflon is capped. So here the last drop of blood is gone, the set is removed from the patient, blood drains in, and when it reaches the venflon, the stopper is stopped and the lower connection is unscrewed from the venflon, which is capped. So the entire procedure without speeding up or editing has been shown in this video, which will help a practitioner to start his own ozone practice. So once the job is over, we open up the lower, disconnect and cap the venflon. From the flushing of the patient's face, you can see that she is hyperoxygenated. After 30 minutes, the venflons can be removed and the insertion sites are properly wadded and taped. The patient has given a written consent that her face can be shown in the video. If the patient is admitted and needed other interventions or other intravenous therapies, one venflon is left into the place. An outpatient is kept in observation for 30 to 45 minutes before being discharged. IAOS EBOO system is the 5th generation dialysis filter-free system introduced for the very first time in the world and is unique. For details about the unique patent pending system, please dial the above number in WhatsApp and send a message with your name and qualifications. The details are meant only for qualified ozone practitioners and medical personnel. This is not a patient education video, and details of the procedure are sent to medical practitioners who message in the above WhatsApp number. Please ensure that calls are not made to the number. Thank you very much for patient listening of the talk. Thank you.
Blocks and ozone MHT EBOO with early function speeds up bone healing also dramatically. Take home messages. Be aware of reactive oxidative species and their detrimental effects on human body at cellular and immunological level. Ozone is a less understood molecule. Hydrogen is yet to be a discovered molecule. Master ozone and hydrogen and we can conquer many unconquerables. Numerous conditions can be treated with these methods, and we need much more research and studies on these. Hundreds of therapists are using hydrogen and ozone IV therapies, and results so far have been outstanding. All therapists are welcome to join us in the studies and let us change history and leave footprints on the sands of time. Feel free to message me for scientific data, reference videos and publications. You can message me on this number in WhatsApp. I do not pick up calls from unknown numbers, so please send me a text message. And thank you for helping me to teach, motivating me and learning for the last 40 years, where I have had the pleasure of teaching orthopedics. Thank you all very much for listening to this lecture. Thank you.